Okay, I want to help clear up a little bit of confusion. You're probably hearing two different numbers being used by Democrats and other advocates when they're talking about how many people will be affected by Republicans' Medicaid cuts. Those two numbers are 8 million and 14 million. We're hearing Democrats talk a lot about how 14 million people are going to lose their health insurance under Republicans' bill, but then sometimes we also hear people say 8.6 million people are going to lose their health insurance. So which one is it? It's kind of both. The 8.6 number refers to the estimate that the Congressional Budget Office, who are nonpartisan, put together just this week. They say under Republicans' tax cut plan and the cuts they're planning to make to Medicaid, 8.6 million people will lose their Medicaid coverage over the next 10 years, right? That's just flat out the way it is. But there's another part of this, which is that one of the things Republicans could have done with this bill, if they had chosen to, is extend the tax credits that helped working Americans pay for their Affordable Care Act insurance. They were passed under President Biden, and they made it so that millions more Americans could afford their health insurance. But of course, Republicans declined to extend those. So the CBO took a look at that and said, well, when those go away, 5 million Americans are going to lose their health insurance because they simply won't be able to afford it. Anyway, when you take the 5 million people who will fall off of their health insurance and add it to the 8.6, rounded up to 9 million people who are going to lose Medicaid because of Republicans' cuts, that's where you get the 14 number. Democrats are using that number. Republicans say it's dishonest because the 5 million people who are going to lose their ACA coverage, that's just the way it used to be for them. So it should be considered just normal, not a new cut. You can decide which number you use. I just wanted you to understand why those two numbers are being used by different people. The one thing we all do know for sure is that even one person losing their health insurance unnecessarily is wrong and morally abhorrent. And with that, class dismissed.